welcome to Crime Bytes, the show where we talk about some truly bizarre and disturbing crime cases. My name is Liz. Today is True Crime Tuesday. So, I'm still getting over this cold, but I've got my comfy bathrobe and my tea. Got my dog coming to join us. So let's do this. The last 2 weeks we talked about people who fake cancer and who go as far as to create fake GoFundMes and who get into criminal trouble when their lies grow to outlandish proportions. And I said that last week we were done, but we were not completely done because while I was researching, I came across another story that, well, you'll see, it kind of had to be part of this little mini-series or whatever this has turned into. But before we hop into that, let's pause for a quick promotion. And I am going to promote myself again today, because why not? And if you're newer here, I also make resin jewelry, and one of my favorite things to work with is butterfly wings. Butterflies are just super cool. Beyond being just awesome creatures, they also symbolize transformation, change, and rebirth, which kind of feels appropriate today. Anyhow, I am making some new pieces, and look at this wing that I found. Look how cool it is. Even, I didn't finish it yet, and I don't know what type of butterfly this is, but it has these two false eyes. And I've had these tiny whole white butterflies before, but I think this is my first white large wing that I've ever worked with, and I don't know, I like it a lot. But I do procure almost all of my wings from a local conservatory where you can go and walk around with the butterflies, and then after the butterflies pass, they sell the wings to kind of keep themselves going, and there are a lot of people who buy them for art. So if that's something you would be interested in, you can head on over to my Etsy shop, and if you don't see exactly what you're looking for on there, you can feel free to shoot me a message. All right, let's get to today's story, and let's start by meeting Maggie Dorsey. Maggie was a bright and vibrant mother of 9 who loved doing things for her children. In 2004, unfortunately, she was diagnosed with multiple myeloma, which is a form of blood cancer, and her doctor would put her on a very aggressive form of chemotherapy to fight it, and it was really hard on her. And it got so bad that she was unable to walk and use her hands normally, which was really terrible because she had 9 kids to take care of. And one of the things that she really took pride in was doing her daughter's hair. And now, not only did she have this horrible cancer, she couldn't do these basic things for her children anymore. And what she could still do, or managed to get by doing, she was doing in excruciating pain, and she spent many of her days bedridden. And she was in and out of the hospital as a result of chemotherapy complications. And at that point, she decided to get a second and third opinion about her situation. She was being treated at the time by one of the most renowned cancer doctors in Michigan, but at the time, she was also feeling like his aggressive approach was really more than she could handle. And when both doctors ran tests on her and came to meet her for a follow-up discussion, they both had the same news to share with her. She didn't have cancer, which I'm sure that must have been the greatest news ever to receive. She just spent 7 months of her life destroyed to get rid of this cancer, which made the next thing they told her just mind-blowing. She had never had cancer. She had been misdiagnosed. Obviously, she was feeling a wide range of emotions, but one of the biggest questions on her mind, and I'm sure on all of yours as well, was why was she diagnosed with cancer she didn't have? And not only that, why was she put through a more strenuous than normal regimen to battle it? After careful consideration and realizing that she would have to suffer negative effects from the chemotherapy for the rest of her life, she decided to sue her doctor for medical malpractice. She would go on to state, "Even though I am not dead, I am a shadow of my former self." In 2009, she would settle outside of the court and attempt to move on with her life. But she then ended up receiving a bill for her treatment, which I'm sure was like a huge slap in the face. But in the end, she would not end up having to pay for it. Can you imagine thinking that you were dying, going through just really horrible, painful treatments, only to find out that you weren't dying to begin with, and now you're stuck with all these just painful side effects? On one hand, I'm sure you're extremely grateful, and on the other hand, I would be very surprised if you could come away from something like that without just a touch of bitterness. I'm pretty sure I wouldn't be able to. But let's fast forward to March 31st of 2010 and meet Angela Swantek. She had been an oncology nurse for quite some time and was very excited to be interviewing at MHO, or the Michigan Hematology and Oncology Clinic in Rochester Hills, Michigan. It had one of the highest reputations in the area, and she was looking forward to the opportunity to work there. Until she started shadowing one of the nurses working there and was basically shocked by the care that was being provided. She observed that patients were being given very long chemotherapy infusions, drugs that were normally given a day after chemo because the body needed some time to kind of recuperate, were being given right after chemo on that same day. Angela would choose to leave the clinic despite its great reputation. She just felt very strongly that from what she observed, it just wasn't right. It was beyond what would be considered acceptable aggressive cancer treatment. And she was so unnerved that she chose to report the clinic on April 14th of 2010. In all her years as a nurse, Angela had never felt the need to do something like this, but it had gotten to her that much. Just from what she was told and could see from shadowing that nurse at the clinic, more harm was being done to the patients than good. And it would take over a year for a response to come to her. On May 13th of 2011, she would receive a reply from the Department of Licensing and Regulatory Affairs, and they would state that there was no violations that had been established and that the investigation was being closed. Except it actually appeared that there never really was an open investigation to begin with. That would come out a little later. In 2011, Christopher Sneary was diagnosed with testicular cancer and was receiving treatment at MHO. He underwent 40 days of chemotherapy, 14 days of hydration, 3 iron infusions, 3 blood transfusions, 24 steroid injections, and 37 radiation treatments. He also had one of his testicles removed, which may have been unnecessary. Since his treatment, he has reached out to other doctors for their opinions on his case, and they told him that he was overtreated basically, and that the cancer that he did have should have been a lot easier to get rid of than what he was put through. As a result of his treatment, he now suffers from neuropathy in his hands and feet. His kidneys almost failed, and his bladder and liver were compromised. He has to live with lasting results from the excessive treatment, like Maggie, for the rest of his life. Then in 2013, 54-year-old Monica Flagg would go to see her primary care doctor, who would notice something in her blood work that concerned him, and he would send her for some additional tests. And they would go through MHO. She would meet with the practice's owner, Dr. Fata, and he would regrettably inform her that she had multiple myeloma. Not only that, but she would need to start fighting it in an aggressive manner with chemotherapy if she was going to have a chance of surviving it. On top of this, having this terrible diagnosis, she had a bad feeling about Dr. Fata. And she didn't feel ill at all, but she would begin treatment because she trusted her doctor and all the reviews that she read about Dr. Fata. She would go into her first session of chemo, and when she got home, poor lady, she tripped and broke her leg, and her husband would take her to the hospital where she would be seen by one of Dr. Fata's associates, Dr. Maunglay, because Dr. Fata was away at the time. And while he was going over her chart, his expression grew troubling. When he was done, he would ask her a bunch of seemingly routine questions, and then he would go. She would stay in the hospital for the night, unnerved by their exchange. She felt like the doctor was almost questioning her cancer diagnosis. And the next day, Dr. Maunglay would somberly come into her room while she was entertaining a guest and asked to speak to her alone. She knew something was wrong, but after hearing that she had probably terminal cancer, how much worse could it be? When her friend left, Dr. Maunglay told her she was in good health for her age, and most importantly, she didn't have cancer. Then he told her that she needed to remove herself from Dr. Fata's care and never see him again. What? Dr. Maunglay had some suspicions himself about Dr. Fata's practices, so after he met with Monica and saw how healthy she was, after first looking at her terrible chart, he spent a day going over her files and all of her test results and was shocked to discover that not one of them indicated that she had cancer. And that's exactly what he told her the next day, and she was thrilled, but it left another question. Why would Dr. Fata tell her that she had cancer if she didn't? Dr. Maunglay was actually planning on leaving Dr. Fata's practice the next month because of another lie that Dr. Fata had told him about his practices being a part of this professional quality program that they weren't actually a part of, and he didn't have the best feeling about the guy either. I don't know. Something about him. I see it. So we decided to dig more and look for some patients that had a similar presentation to Monica's case. And guys, he was shocked by what he discovered, and I'm sure you will be too. But first, let's meet Dr. Fata, or Farid Fata. Farid was born on March 31st, 1965 in Lebanon, and he grew up in a Catholic church, and he always knew that he wanted to be a doctor. He would graduate from Lebanese University in 1992 with his medical degree and moved to Brooklyn, New York at 27 to start his residency. He spent 3 years at Maunglay Medical Center working on his residency, and then he did his fellowship at Memorial Sloan Kettering Center in Manhattan, which he completed in 1999. From there, he would move to Danville, Pennsylvania, where he became an attendant at Geisinger Medical Center, and he would stay there until he decided to start his own practice, and MHO was born in 2003. As his businesses grew, his wife Samar would help him run the business aspects of the company, which quickly grew to companies. She would formally become the CEO and CFO of his companies, and the pair would have 3 children together. He specialized in treating blood cancers, and he did so well with the business aspects of his practice that he ended up owning his own lab, pharmacy, and even a radiation treatment facility. He would speak at many cancer events and was known for believing in a more aggressive approach, or the European approach, as he would call it. And it was working. He was known as one of the best cancer specialists in the area, and MHO was the place to be treated at. Then in 2007, he was hit with Maggie's lawsuit and was able to settle it outside of court in 2009. The same year, he became a naturalized citizen. There would be other staff members who may have raised their eyebrows over the years, but things would just continue until that July in 2013 when Dr. Maunglay essentially discovered his secret. And what he would end up finding after digging just a little bit deeper would shock the world. Dr. Maunglay found cases where Dr. Fata was giving drugs to patients who did not need them. Drugs like chemotherapy. One drug was IV immunoglobulin therapy for patients with immune deficiencies, and a nurse would discover that in 1 week, 38 of 40 patients giving this drug did not qualify for it. So Dr. Maunglay would discuss his findings with a nurse, and they would end up confronting Dr. Fata, who would kind of just put his hands up and agree to stop using the IV immunoglobulin. Gosh, the words today. And they would just kind of carry on, but this threw them off even more because, all right, we caught you and now you're like, all right, fine, I won't use it. Carry on. But it threw other people off as well because many people put in letters of resignation without explaining why. Then George Karadsheh, one of the office managers, was a little thrown off by so many people putting in their letters of resignation, and he started hearing some of the allegations on the down low, so he started asking questions, and he wound up talking to Dr. Maunglay. That discussion made him start to think of other concerns that were raised by various staff members about Dr. Fata's aggressive protocols. Then he started contacting and interviewing other staff members. Dr. Fata's consultation to treatment ratio was very different from that of other doctors. When he felt like he had enough evidence, George went off to the U.S. Department of Justice with all of his findings, and they would interview him on August 2nd of 2013. Shortly after that, federal agents would start interviewing staff, and on August 6th of 2013, the FBI would raid Dr. Fata's offices and home, and he would be arrested on 19 counts of healthcare fraud and other crimes. He was brought in on $170,000 bond, which was subsequently raised to $9 million when the judge considered that he was probably a major flight risk. Investigators would find evidence that 553 people were victims of Dr. Fata's medical malpractices. It was found that he was both falsely diagnosing patients with cancer, giving his patients who actually had cancer unnecessary aggressive treatments for that cancer, and giving chemotherapy to hospice patients. And why? You probably guessed it. Money. He was billing the insurance agencies for treatments, using the proceeds to run his own diagnosis testing facility and order more unnecessary tests, and so on and so forth. It goes round and round. When all was said and done, his fraudulent claims earned him upwards of $34 million on top of his already successful practices. Or what they were making legitimately. Not only that, 2 local hospices were paying him illegally for referrals. This man could not get enough money and had no issue with whatever he had to do to get it. So he was sending people he was over-poisoning to hospice and then getting money for that referral and continuing to give them these painful treatments while they were dying in hospice. Disgusting. He was charged with 23 counts of healthcare fraud, conspiracy to receive kickbacks, money laundering, unlawfully procuring naturalization, because he was doing all this fraud while he was becoming a citizen. He was facing 175 years and deportation. He did take a plea deal on September 20th, 2014, pleading guilty to 13 counts of health care fraud, 1 count of conspiracy to receive kickbacks, 2 counts of money laundering. On July 15th of 2015, the judge would sentence him to 45 years in federal prison and to undergo treatment for substance abuse. He had to forfeit millions of dollars of assets and pay restitution to victims and their families. All of his victims would request the maximum sentence for him, and he would not look up for the majority of the victim impact statements read to him by 22 of his victims. He would say, "I misuse my talents because of my power and greed. My quest for power is self-destructive." He would say he was sorry. People passed away from overtreatment. His wife would divorce him and flee back to Lebanon with their 3 children. Ironically, since being sentenced and put in prison, he has developed a rare blood disorder and would like to be released so that he can receive proper treatment. He became infected with COVID-19 in December of 2020, and as a result, he developed multiple infections in his skin, prostate, bladder, eyes, and gums. A drug called Nupogen, which is used to help reduce the infections caused by low white blood cell counts and is commonly prescribed to patients while they are undergoing chemo, could potentially help his condition. His filing states, "Fata today appears 180% different than Fata 11 years ago." I'd like to know if he wrote that or his lawyer did. With his 45-year sentence, he would be in his 90s when he is released. What do you guys think? He argues that he should be released now to receive proper treatment. Let's meet Robert Sobieray. I'm so sorry with these names. They are rough today. Robert was a disabled auto worker. In 2010, he was told he had a rare blood cancer, and Dr. Fata put him on monthly chemotherapy infusions and weeks of radiation. The treatment caused his body to go through uncontrollable twitching spells, and all of his teeth fell out. When Dr. Fata was arrested, he learned that he didn't ever have cancer either. Now let's meet Patty Hester. She was diagnosed with myelospalas. Oh my gosh, I can't with these. Anyways, it's MDS, which is described as a cancer-like condition or a pre-leukemia. She would be told that her condition was terminal, but instead of being put on a bone marrow transplant, which would have been considered the normal protocol for her situation, Dr. Fata opted to give her both iron infusions and that drug that was used to treat the immunodeficiency diseases. And he tried to get her to go to chemotherapy, but she really didn't want to, opting for what she thought would be a shorter but better quality of life for whatever time that she did have left. And her husband Michael would say that they took a rushed family vacation to Disneyland, and Patty started giving away her belongings. She was really believing that she was dying. And he would get lost in drinking and pick up smoking. Both of them fell into this really bad depression. After Fata was arrested, she got retested as well, and she discovered that she never had cancer. She describes feeling joy and then feeling anger. She felt anger for the 3 years that she lost because of his lies, and now she deals with high blood pressure and hair loss from her unnecessary treatments. Not to mention the emotional damage and the stress from just everything that she and her family went through. Steve Skrzypazak, sorry again. Steve had a Mediport implanted onto his chest for non-Hodgkin's lymphoma. He underwent 25 chemo treatments in 6 months, which for this drug in particular would have been 4 times the recommended amount of chemo. Then he found out he never had cancer. After Dr. Fata was arrested and he saw 2 other oncologists, just like Maggie, Robert, Monica, and Patty, they told him he didn't have cancer. He never had cancer. He has to say this about Dr. Fata. He is a monster and a master of deceit. I lost 3 years of my life to cancer treatments. I hate this man. Some may choose to forgive. I never can. Maybe God can. I'll leave you with this quote from Maggie Dorsey. I have days where I cannot stand. Most nights the pain is too great to allow me to sleep. I told him of my pain in hopes of receiving mercy. He decided that I should endure more and gave no mercy to my family or myself. Every person he treated was never just an I, always a we or an us, because each person is connected to a family. All of us are changed now forever. 553 people. So crazy. Do you guys think he should be allowed out? All right, let's get Scoot Dog over for our real fact of the day. Come here, Scooty. Hi. Here we got bacons. Oh. He's done today too. My goodness. We're done today. Today's real fact is, if you're not sure, get a second opinion. I mean, I probably should have taken this advice with a few things myself, but if you get a crazy diagnosis and something feels off, it's your right and frankly your responsibility to get a second opinion, even if it hurts feelings. All right, guys, what about that one? It's funny because while I was researching the people faking cancer for money with Belle Gibson, specifically the question came up, why would a doctor tell someone they have cancer when they don't? And here we are. Apparently he was not the only one who's done this either. However, he will be the only one that I cover for now. I cannot handle this. I can't handle any more of the fake cancer. With these people, they had treatment records and a doctor's name, and they were able to be compensated after the fact. Belle was just straight up lying. I mean, unless she has those records that she keeps saying she has and they materialize, right? Anyhow, guys, it's time for our positive highlight. And February is National Cancer Prevention Month. If you don't know, you do now. So we're going to highlight the American Association for Cancer Research. This association is dedicated to researching ways to prevent and treat cancer. Some highlighted examples are quitting smoking, maintaining a healthy weight, exercising regularly, and protecting your skin from the sun. All good advice, and I have to work on some of those myself. In the meantime, if you would like some more tips or to learn more about this organization, visit aacr.org. I'll leave that link in the description for you guys as well. Well, guys, Valentine's Day is this Friday. Are you ready? I'm ready for whatever, maybe. I don't even know. Life is always interesting, but it will be this channel's 2-year anniversary, and if I'm not out on a hot date, or maybe even if I am, I'll try and hop on here with a special for you. But if not, be ready for some bad romance next Tuesday. We'll look at some romance gone wrong in the spirit of Valentine's Day. Alright guys, if you missed the first 2 episodes in this series, click one of these links. And until next week, please stay safe out there. Bye!